197 new COVID-19 cases have been recorded in Victoria in the past 24 hours. It comes after the state recorded its two highest case tallies in recent days. We're expecting to hear from Victorian Premier Daniel Andrews and Police Minister Lisa Neville in the next few minutes. In New South Wales, an 83-year-old man infected in the Crossroads Hotel cluster has died. There have been more than 50 cases connected to the hotel in Sydney southwest. New South Wales Health has announced 17 new cases since yesterday. The head of the World Health Organization says the effects of the pandemic will be felt for decades to come. There's been a record daily increase in cases worldwide, with more than 292,000 infections on Friday. The biggest increases were in the United States, Brazil, India and South Africa. James Murdoch is resigning from the News Corp board because of disagreements over editorial content. He had served on the board alongside his father Rupert and older brother Lachlan. James Murdoch has taken issue with News Corp's coverage of the summer bushfires and climate change more generally. His resignation takes effect immediately. We are standing by to hear from Victoria's Premier Daniel Andrews for today's coronavirus update. The ABC understands 397 new COVID-19 cases have been recorded in the state in the past 24 hours. We'll be bringing you that press conference once it begins. That's expected shortly. And we are also going to be hearing from Queensland's Deputy Premier Stephen Miles for an update on cases in Queensland. The state reported 6 new cases yesterday. Governments around the globe are nervously watching the race for a vaccine to the pandemic, which would mean a return to some form of normalcy. Adam Kamrat-Scott is a global health security scholar from Sydney University and a non-resident fellow at the United States Study Centre. And this week he was part of a webinar with the US Chief Medical Advisor, Dr. Anthony Fauci. He says he is privy to some of the latest developments in efforts to produce an effective vaccine.
The webinar was organised by the India Council for Medical Research and London School of Hygiene and Tropical Medicine, and what they really wanted to bring to the fore was a discussion about the ethical standards and the processes that we'll be following in developing vaccines, and then how we take the next step to actually ensure that it is available as widely and as freely as possible. So in particular, one of the key focuses was around this idea of the human challenge trials, which are being sort of advanced or put forward, and there was widespread disagreement around the appropriateness of these.
We're going to interrupt there and take you live now to Melbourne, where the Premier Daniel Andrews is giving a coronavirus update.
Very good. Thanks for joining us for the update. I can confirm that the cumulative total number of cases in Victoria is now 10,931. That's 397 more than we reported yesterday. The breakdown of those cases is 37 that are linked to outbreaks and other complex cases, and 360 that are under investigation by our public health team. That is a very significant number of new cases, and whilst there's always a temptation to try and read trends into these numbers, there is a growing concern in relation to the number of community transmission cases within that data. I'll return to that in just a moment. In the meantime, can I indicate to you that there are now 116 people who have passed away as a result of this global pandemic. That is 3 further deaths since our last report. A man in his 80s, a woman in her 80s and a woman in her 90s. We send our condolences, our best wishes, our support to each of those families. This will be an incredibly difficult time for them, and we hope there is some small measure of comfort knowing that we are with you and that we send our best wishes to you. In terms of total active cases, there are 5,919 of those. In terms of hospital patients, there are currently 379 patients in hospital and 41 patients that are in intensive care. 24 of those ICU patients are on ventilators. In terms of testing numbers, we have now conducted 1,633,953 tests. That's an increase of 25,501 since our last update. There are now 1,075 cases amongst health workers, and the total number of cases in aged care, active cases in aged care, is 1,008. If I can just speak a little bit to aged care, and then I want to talk about community transmission just for a short time, and then Lisa's going to take you through some compliance and enforcement issues, and of course Deputy Commissioner Nugent is here as well, and happy to take any questions you might have. The situation in aged care remains very serious, a very significant challenge, very confronting in many ways, and we know and understand that this is incredibly difficult for residents, very, very difficult for families as well. All governments, all agencies are working together as closely as we possibly can to have one focus, and that is on residents, their wellbeing, their health, and by extension, the wellbeing of families who are obviously concerned and very keen to get as much information as quickly as they possibly can. I can confirm for you that there's now been 570 shifts worked by hospital nurses across a number of private aged care settings. That is something that we should be very proud of, very, very proud and very grateful to those teams of nurses and other health workers who support them. These are confronting environments, these are very challenging environments, and as always, our nurses are stepping up and doing the most important work. To all those Victorians who are not following the rules, and it's by no means the majority, the vast majority of people are following the rules, and we're deeply grateful to you, but to those who are not, you need to just think for a moment. Nurses and doctors and ambulance paramedics and others in our health team, they're stepping up and playing their part, and it's up to you to step up and play yours. This will not end anytime soon if people don't follow those rules. And I don't want to detract from those who are. We're very grateful to them. And it's lots of different contributions in lots of different ways. But for those who are not doing the right thing, and Lisa I think will speak to some quite amazing examples of that sort of behaviour, all you're doing is contributing to the spread of the virus. And whether you want this to be over sooner, whether you want to avoid a fine, whether you want to protect your family and every family, or whether you honour the work that our healthcare workers do, our heroes do, then you've got to make much better choices than have been made in recent times. Just before I hand to Lisa on community transmission, can I indicate that of those active, this always lags a day behind because those cases that we're investigating, obviously it takes some time to investigate those. But we can, as a result of that effort, so that'll be from recent days, confirm that there's an additional 49 cases, mystery cases, 49 cases where we simply cannot track back what the index case is, what's the zero case, where did it start, where did those people get it from. Now the challenge with that, of course, is they are a mystery, and this is all about trying to know as much as you possibly can, as much intelligence and evidence and data as you possibly can. Those 49 cases and many more beyond that, if you look at the entirety of this pandemic, something like 1,841 cumulative community transmission cases since this began. So as a feature of the 10,931 I just read out, you can't be certain, of course, if there's that many that you don't know how they got it, you can't be certain that there isn't even further community transmission, even more mystery cases out there. That is, in some respects, our biggest challenge. No one wants to see large numbers reported in any context, but if you can track back where the origin of that was, then they're in a wholly different category to community transmission or mystery cases where you just can't work out how the person got it. That is a real concern, and that's what's driving some of the work that's being done. Was being done last night and today. Our public health officials engaging with some of their interstate colleagues, their national colleagues. It's a very significant group of experts that are working through those particular community transmission numbers and doing not just modelling, but looking in very fine detail at all of that data. Today is not the day to announce any further steps, but that work is under active. That is an active process. We are giving due consideration to a whole range of different options. And when I'm in a position to announce decisions that I've made, then of course I will do that, and we'll take any and all questions about that at that time. But I know 49 doesn't seem a very large number, but I just say to all Victorians that 49 where you can't be certain how they got it, that can mean there are many more than 49 out there that have very mild symptoms or no symptoms at all, can be at the height of their infectivity and be infecting other people even unbeknownst to them. That's the real challenge here. It is a silent enemy. It is a very cunning enemy as well. But particularly those community transmission cases, they are of greatest concern to us. And that's why we find ourselves deep into a process to evaluate these things. And we can't rule out further steps being taken. They'll be taken because that's what's necessary. There'll be nothing else driving it. But when I'm in a position to make further announcements about that, then of course I will. Just before I do throw to Lisa, I do want to thank every single Victorian who, whilst not enjoying this experience in any way, whilst being frustrated, you are still doing the right thing. That is incredibly important. It is a point of pride. We are all in this together, and anybody who doesn't think that's accurate, well, that's not only the wrong judgment to make, it's not a very smart judgment to make, because Victoria Police, of whom I am very proud and grateful for the work they're doing, are out there doing that compliance work. They are issuing fines. They don't take any joy in doing that. They'd much rather be out there on their regular patrols, not finding anybody doing the wrong thing. But we have seen many examples of people who are not abiding by the rules, and that simply is, no one's entitled to do that, because there isn't a cost simply for them. There is a cost for all of us. So, to those who are doing the right thing, we are deeply grateful, particularly to those in our health team who are working hundreds and hundreds of shifts in very, very challenging circumstances, whether that be stepping in to replace entire workforces in aged care homes or working in COVID-specific wards and treating patients who are gravely ill in our hospital system, public and private. We are very grateful to them. If you value their work, if you honour the skills and care, courage and compassion that they have, then we've all got to do the right thing. They're playing their part and we have to play ours, all of us. We are all in this together. Whether we like that fact or not, it is the reality that we confront, and it is the only way, it is the only attitude that will get us to the other side of this. Now, to speak about some of those enforcement matters, and again, I don't want this to in any way detract from the great work that so many Victorians are doing, but it's appropriate to call out really bad behaviour when you see it, and that's exactly the purpose of some of the details that Lisa will provide to you. But the other point about her commentary will be a really profound thank you to Victoria Police and others, authorised officers and others who are doing a fantastic job. I don't have an ADF door knocking update for you. As soon as I can get you one of those, I will at a subsequent briefing. But there's a big team out there doing that door knocking, every single positive case being door knocked. We are still finding people that aren't home. They should be home. There are significant penalties, and we're having a look at whether there's any need to change any of those penalties. There are options available to us, whether it be the on-the-spot fine versus fining people through the courts. That's a much bigger fine, but there is a balance to be struck there, and we will find that balance. But I do want to be very clear. It is not acceptable. It is not acceptable to have this virus and be out and about, going about your normal business. That is simply not appropriate. That's very dangerous. It's fundamentally irresponsible, and it needs to stop. And that's why Victoria Police and the ADF and authorised officers from the Health Department are out there literally knocking on doors. It's the wrong choice, and it's not a very smart choice. You will get caught and you will get fined. I'll now ask Lisa to add to my comments, and then we're happy to take any questions you have.
Thank you, Premier, and good morning. I too just really want to start by saying the overwhelming majority of Victorians every day are doing the right thing, from wearing masks when they're required to, from not leaving home for those 4 reasons. People who are not trying to get into non-restricted areas. People in Geelong now who are not having visitors. And I want to thank them, because it is the overwhelming majority of Victorians. However, we are still continuing to see appalling behaviour. Appalling behaviour that I know Victorians themselves are fed up with, and you see that every day, people making comments about that. I'm fed up with it. Victoria Police are fed up with it. Can I be really clear, just in case there's any doubt at all, that there is absolutely no reason or need to drive from Melbourne to Wodonga to have a Big Mac. And that's one of the fines that was issued yesterday. There's absolutely no reason or need to drive from Melbourne to Ballarat for fresh air. There's absolutely no reason to drive from Werribee out to Springvale to buy groceries. They're just three of the fines that we saw issued yesterday. And behaviour that is, again, you ask why are people, why would people think that that's okay? They either don't care. It can't be because people aren't aware of the rules. I think there's no question when Victoria Police pull people over, they're aware of the rules, but yet have made a decision to blatantly breach the Chief Health Officer's directives. And those people all received a fine yesterday, as did people who decided having an Airbnb party was okay, and they all get issued with a $1,652 fine. Or the people who continue to operate and go to a brothel. So again, fines and behaviour that is appalling and unacceptable and does need to stop. We all have a role to play in this. Victoria Police, their PSOs, the ADF, working side by side are out there doing what they need to do in order to stop the spread, work with Victorians, provide reassurance to Victorians, but to hold those people to account who are displaying blatant disregard for the directives that have been issued. Directives that are tough, I know, for many people, but the directives that most Victorians are abiding by, and all those Victorians expect everyone to abide by those directives, or for Victoria Police to hold them to account. So we've now reached the point where Victoria Police have done over 200,000 checks. So that's the community checks, out and about in communities, making sure that we don't have mass gatherings, making sure people are at home, making sure that people are abiding by the 4 restrictions, making sure that people are wearing masks. So over 200,000 checks, a significant amount of work from Victoria Police. In terms of the road checks, they've now reached over 452,000 checks on our roads since the road stops were put into place. A significant amount of work, working side by side with the ADF. I know today out with Victoria Police we have about 247 ADF staff working side by side with police at those stop points, but also out in the community at key areas, whether it might be the TAN or where we know we've got particular groups encouraging people to breach the directives, cycling groups, for example. So together ADF and Victoria Police are working side by side to make sure people are following the directives. We've also got our police on our train stations, at ferries. We've got our PSOs out in the community doing checks. We've got PSOs at train stations. So if you're thinking of using a whole, back roads, if you're thinking you can get around these rules, find ways to get around the rules, Victoria Police will be there. They don't want to be doing this. They don't want to be fining people. That's not their role. That's not how they work. But they will do this because they know it's in the best interests of Victorians and Victoria's health. And it's the best way we can get out of these lockdowns if we all abide by those rules. So I want to thank every member of Victoria Police, every PSO, every member of the ADF who are working with us. They are doing an extraordinary job, an incredible job, a job that no one imagined they would have to play. And in my view, they are playing such a role that it is about saving lives and protecting Victorians. And I want to thank each and every member. And the way you can thank Victoria Police members is do the right thing.
Good. I'm happy to take any questions you have.
Whether you think JobKeeper payments should remain the same for Victorian businesses that they're going through?
Well, JobKeeper payments and job seeker arrangements have been extended until March, and I think that all Victorians, indeed all Australians, are very pleased with those announcements that the Commonwealth Government made. As for any additional support for Victoria, I'd always reserve the right to continue my very productive discussions with the PM about those sorts of arrangements. They're not matters for me to announce. They're not matters for me to be lobbying for publicly, I suppose. I've got a good relationship with the PM. We'll be talking later again today, and so we're talking again later today. And I think the Prime Minister knows, and they've structured, Josh Frydenberg and the Prime Minister have structured their payments and their support to match the hardship that's being experienced. There's hardship here, of course there is, but there's hardship in lots of other parts of the country as well. Whether we need to go to additional support, of course I'd always reserve the right to have those discussions with the PM, and I'd be very confident that I would get a good hearing.
Can you clarify how many, if any, of those 3 deaths occurred in aged care overnight?
Sorry, Jodie, yes, I should have. I believe all 3 of them are connected to aged care. However, let me wait until the Chief Health Officer's report, media release comes out later in the day, just to double confirm that. If I can, in the intervening period, if I can confirm that, I will.
Just another question.
Sure.
Tony Bartoni from the AMA has asked for all services, bar supermarkets, pharmacies and doctors to close. Where do you stand on those calls?
Well, we are considering a number of options. What we've got at the moment, numbers that are too high, community transmission or mystery cases that are growing. That is a real concern to us. I'm trying to be as frank as I can be. I don't have announcements to make today, but there is a lot of work going on because this is not an easy thing to do. If you take further steps, you've got to make sure you've thought it through properly, that the rules can function, that any changes to the rules will actually deliver the desired outcome. And that is, in many respects, a circuit breaker to try and pull this up. I have known Dr. Bartoni for a long time. I absolutely respect him and the work that he does. But again, today's not the day for those announcements. We're doing a lot of work, and when we are in a position to have more to say about any changes, of course we will.
Some of the options being canvassed is the closure of certain businesses or industries. Is there work happening behind the scenes at the moment to secure supply lines, for example, meat and food and that sort of thing?
Part of the consideration of any additional moves has to be all of those sorts of issues, so people can be confident that all of those things are being thought through. Again, the best thing to do is to, if I can respectfully ask, we will do that work, and then when we're in a position to indicate the decisions that I've taken, the actions that we're going to take, then I'll be in a position then to brief you up on that. But you can rest assured, as can your readers and viewers and the rest of Victoria, can be absolutely confident that we're thinking through all of those issues. That does take a little bit of time. It's not a tap that you can just turn on or off, and they're not decisions that would ever be taken lightly, because there will be significant costs associated with even minor changes to the rules do come with a significant cost. But numbers are too high, and there is a growing case for us to do more. We will, what we may be doing now may not be enough when you consider it's brought the stability. It's not like these, as Brett indicated yesterday, these settings, as challenging as they are, have avoided the notion of thousands and thousands of cases each day in our health system being overwhelmed. That shouldn't be read to think that anyone's doing it easy in our hospital system. It's tough. It's very tough. Aged care particularly is very, very challenging. But we can't open up again at these sorts of levels, and therefore there's very detailed work being done about what possible next steps might look like.
What is that data that you're considering?
It's particularly not just case numbers, but a really granular breakdown of where those cases are coming from, what the common features of chains of transmission are, how many cases we can essentially wrap our arms around and deal with, and if you like, put those spot fires out versus those that we simply can't find the index case. That community transmission number, again, people, in the scheme of things, as we stand here every day, 49 doesn't necessarily seem a large number, but 49 mysteries, when it could be much more than that because you can't find who that original case was, that is a very significant concern to us.
Premier, can you a number of GPs this morning who have patients that have tested positive who still haven't heard from the contact tracing team for more than 36 hours? These are vulnerable patients who don't have family who can provide supplies. Do you still think there are enough people in that contact tracing team? And are you still thinking that the timeline is 24 hours or a day to get back to these people?
That's certainly the advice that I've got. I'm happy to follow that up for you. If there's specific examples, we can do that offline so as to protect the privacy of any of those people. In terms of contact tracing, it's an enormous team. They're all working very hard, but I think we all have to acknowledge that when you're talking about cohorts, groups as big as this, is going to push any system. It is much bigger than it's ever been. It grows by the day in different ways, but it's a massive challenge. And for instance, again, not for the apportionment of blame or anything like that, but we do find it hard to get through to everybody. There are some people who, for one reason or another, are not answering the phone. They're not in a position to be able to participate in that long-form interview, which gives us all the kind of treasure for us to then go and trace all the people that they've spent time with. That's why we've moved to the situation where the ADF and an authorised officer from the health department goes out and visits those people. And again, just to be clear on the context of that, yes, they're finding some people that aren't there. That's a great concern. They're also finding people who perhaps need a little bit more information, and they're able to provide that to them. And then there are other people who need a script filled or they need groceries. So it's not just about compliance, as important as that is. It's also about reaching out and saying, what can we do for you? What support do you need? Because getting everyone through this, that obviously leads to much, much better outcomes. On turnaround times, and I'm more than happy to try and chase that up.
Premier, can you confirm that Annalise Van Diemen has been moved on from the role of Deputy Cho, and does that show that there's discord within the team? No,
I wouldn't say that at all. This is a united team, and a team that's focused on the biggest challenge that any of us have ever faced. Dr Van Diemen is a very eminent person and someone who's got skills and abilities that have been well proven during this crisis. But there are other functions. You see the avian flu issue that's being dealt with today. There are other public health and infectious diseases challenges beyond this. I know it's quite difficult to think beyond this particular crisis, but we have to have systems and processes in place that do just that. Otherwise, things wouldn't get the appropriate response.
Is that overhaul, which is beyond just Dr Van Diemen, is that an indication that things as they are haven't been working?
No, I think what it is a clear indication that this challenge, this task grows by the day, and it's very important that we have the best arrangements in place. So you've got to always be flexible, and if you need to make a change or to add to a framework or to step things up even further, that's not a commentary on what you were doing. It's simply, I think it speaks to a preparedness to make those changes and to enhance, improve, to modify wherever you think that's going to get you the best yield. And that's exactly what we've announced. It's exactly what we've done. I suppose one of the biggest differences would be that I think we've been really clear with everybody about that. But that's not the only change. There's been lots of changes all the way through this. As it's a dynamic problem, a wildly infectious dynamic problem. Therefore, you can't have a static response to it.
Could I ask Minister Neville a question?
You certainly can.
At the moment, as we understand it, if officers approach somebody who isn't wearing a face covering and they say, "Oh, I've got medical dispensation," is there much that officers can do in the way of enforcing those rules? And are you considering any greater powers for officers?
I think we're at somewhere like 270 fines now for masks, so that they are issuing fines.
They are clearly able to demonstrate that they have legitimately got an exemption to wearing the mask, so they've got Ventolin sprays, they've got doctors' material, information, communications, or whatever that support that. So we're not seeing that as a problem at this stage.
How are officers generally feeling about enforcing these rules? They do a tough job as it is. How are they going?
They're going really well. The police members themselves are doing an outstanding job. You know, they're out there on the checkpoints 24 hours a day. So 2 o'clock in the morning, it's freezing cold. They're still bringing in the traffic. They're still talking to the people. They understand the need for this. They understand that we need to have an enforcement approach because there are some people that are just blatantly selfish. What we're seeing is too many individuals who are going about their lives as though this pandemic doesn't exist. That's what we're seeing. And so those people are travelling, as the Minister said, for reasons